Schizophrenia is a prototype psychiatric disorder. History of schizophrenia. Emil Kraepelin categorized schizophrenia into two broad categories based on its course. It was either continuous illness or episodic illness. Continuous illness consists of symptoms of delusions and illusions. It had a continuous course and there was cognitive decline, whereas episodic illness had episodes of mania and depression. And it was normal in between episodes, which was called the lucid interval. Now, Emil Kraepelin gave the continuous illness schizophrenia the term dementia precox and episodic illness into manic depressive psychosis. The next person, Eugen Bleuler, categorized based on the symptoms. Eugen Bleuler changed the name dementia precox to schizophrenia. So it was Eugen Bleuler who coined the term schizophrenia. Now, what are the fundamental or primary symptoms of schizophrenia? The so called 4 A's of Bleuler. One is autistic thinking, that is, withdrawn behavior and also fantasy thinking. Second is the ambitendency, that is, inability to decide. Third is affect disturbances, inappropriateness and incongruent affect. Now, what is appropriateness and congruency? Both are related to emotions. Appropriateness is the emotion which is related to external situation or circumstances. Example, we are happy at a party. That is appropriateness of the external situation. Now, congruency means the emotion in relation to internal thought content, the person's own internal thought content. Example, we are happy after we win a race, we win a game. So that is congruent effect. Both inappropriateness and incongruency are seen in schizophrenia. The fourth fundamental or primary symptoms of schizophrenia, according to Bleuler, is association disturbances, that is, formal thought disorders. The third person, Kurt Schneider, gave a more exhaustive symptoms, more sensitive to schizophrenia and not other disease. Schneiderian first rank symptoms. There are 11 symptoms: 3 thought phenomenon, 3 made phenomenon, 3 auditory hallucinations, and 2 more which are delusional perception and somatic passivity. The 3 thought phenomenon are thought insertion, thought withdrawal, and thought broadcast. The 3 made phenomenon, which are like forced upon the person, are made volition, which is a motor act forced upon that person. Made affect, emotions forced or imposed upon that person. Made impulse, which is the sudden urge. The person feels it is obviously by someone else, that is independent of that person's will, his limbs begin to move about. An example. Now, the 3 auditory hallucinations are voices discussing or arguing about the patient, that is the so called third person auditory hallucination. Voices giving running commentary of activities or behavior. Voices saying the person's own thought aloud, which is also called as thought echo. Okay, coming to the delusional perception. Delusion attached to a normal perception which becomes difficult to understand in an incomprehensible way. Example, the color of this pen is black. I am the richest person in the world. Somatic passivity. Blaming an external agency, for example, a tactile hallucination. Example, I'm having tingling sensation because NASA is shooting radiations at me. Now, coming to the epidemiology of schizophrenia. The lifetime prevalence of schizophrenia is 1% and the incidence is about 0.25 per thousand. If both the parents are affected, the child has a chance of getting schizophrenia by 40%. If, a, if only a single parent has schizophrenia, the child has a chance of getting schizophrenia up to 12%. If one sibling has, the other sibling might get in about 8%. If a monozygotic twins if a monozygotic twin has schizophrenia, the other twin might have a 47% risk. And if a dizygotic twin has, the other twin has a chance of 12% of getting schizophrenia. The most common age of onset is adolescents and adults. The male to female ratio is almost 1 is to 1. But males have a slightly more increased chance and earlier onset than females. There is also a phenomenon called social drift. The person who is going to suffer with schizophrenia might be belonging to an upper socioeconomic class, but after he is diagnosed with schizophrenia, he drifts to the lower socioeconomic class because of possibly decreased employability. Now, according to three body types, the aesthetic, who are the thin and weak body type, have an increased risk for getting schizophrenia as compared to athletic or muscular and picnic or short and fat types. These body types, especially the picnic short and fat body type, have a predisposition to bipolar disorders. Now, coming to the etiology. The genetics says that if a person has velocardiofacial syndrome, which is the 22q11.2 deletion, he has an higher risk of getting schizophrenia. The genes, the other genes contributable to schizophrenia are DISC1, DISC1, which is disrupted in schizophrenia type 1, COMT, catecholomethyltransferase, and NRG1, which is a neuroregulin 1. Now, coming to the neurochemical disturbance theory, which is that excess dopamine and serotonin are the cause for schizophrenia. However, glutamate, GABA, and norepinephrine are also implicated. Now, coming to the symptoms of schizophrenia. There are positive symptoms, negative symptoms, disorganization symptoms, motor symptoms, which are also called as catatonic symptoms, also known as symptoms of conation. What are the positive symptoms of schizophrenia? Positive also can be thought of as psychosis, which consists of delusions and hallucination. This is due to increase in dopamine in the mesolimbic pathway or tract, which is responsible for emotions. The negative symptoms, which also carry a very bad prognosis, include avolition, which is the person is not doing his activities or duties, apathy, which is emotional unresponsiveness, anhedonia, which is the person does not experience the pleasure in previously pleasurable activities, asociality, a affective flattening, that is also like emotional unresponsiveness, alogia, that is decreased speech output. The reason for negative symptoms is a decrease in dopamine in the mesocortical tract. Now, the third variety of symptoms is the disorganization symptoms. The person has a disorganized behavior, which is socially inappropriate, disorganized thought, which are the formal thought disorder, inappropriate affect. Motor symptoms, also known as catatonic symptoms, also known as symptoms of conation, include a lot of symptoms. This category has stupor, extreme unresponsiveness and immobility, posturing, abnormal posture for a long time, waxy flexibility, there is plastic resistance. Example, while abducting of limbs, the patient keeps the same position for a long time. Plastic resistance offered by the patient after the initial or static resistance. It's like the waxy flexibility is like bending a wax candle. Catalepsy, maintaining the position after stopping the passive movement, which is applied by the doctor. Echolalia, mimicking the doctor's words. Echopraxia, mimicking the doctor's actions or behavior. Automatic obedience. This is extreme cooperation, even with painful consequences. If the doctor tells, I'll prick your tongue, so open your mouth and stick out your tongue, the patient will do so without hesitation. This is automatic obedience. Stereotypy, that is spontaneous repetitive movements which are purposeless. Mannerisms, are these spontaneous repetitive movements which are purposeless? But they could be also semi purposeful movements done in an exaggerated manner. Perseveration, they are on command but continuous beyond the point of relevance. These are seen in organic brain disorders. Grimacing, maintenance of an odd facial expression. There could also be mutism and ambitendency, which is inability to decide a motor act. Now, how do you diagnose schizophrenia? The DSM 5 states that these symptoms should last for more than 6 months, whereas the ICD 10 tells that more than 1 month of these symptoms is enough to diagnose schizophrenia. Now, there are delusions, hallucination, disorganized speech or thinking, disorganized or catatonic behavior, negative symptoms. All this must be in a patient, or at least two or more symptoms should be present, and one should be delusions, hallucinations, or disorganized speech or thinking. So, the criteria of DSM 5 is out of these 5, there should be two or more symptoms, and at least one should be delusions, hallucinations, or disorganized speech or thinking. Now, what are the subtypes of schizophrenia? There are paranoid schizophrenia, catatonic schizophrenia, disorganized or epiphrenic schizophrenia, undifferentiated schizophrenia, residual schizophrenia, simple schizophrenia, and post schizophrenia depression. There are 7 subtypes of schizophrenia. Paranoid schizophrenia is the most common type, which has a late onset and a good prognosis. The personality is preserved. There are prominence of positive symptoms. That is a hallmark of paranoid schizophrenia. Catatonic schizophrenia has predominance of motor symptoms. There is catatonia. Catatonic schizophrenia has the best prognosis of all the subtypes. IV lorazepam and DCT is the first line treatment, depending on which country you are currently living in. Disorganized or epiphrenic schizophrenia has an early onset and a bad prognosis. Disorganization symptoms are prominent, severely affected personality. Undifferentiated schizophrenia is a mix of the paranoid, catatonic, and epiphrenic schizophrenia. What is residual schizophrenia? After an acute attack of the positive symptoms, hallucinations and delusions are minimal but prominence of negative symptoms. What is simple schizophrenia? Absence of positive symptoms to start with, and prominence of negative symptoms. The criteria is to observe the patient for 1 year. Simple schizophrenia is the worst prognosis of all the subtypes. What is post schizophrenic depression? It is the depression after schizophrenia and it has an increased suicide risk, increased morbidity, and suicide is the most common unnatural death in schizophrenia. 20 to 40% attempt suicide, but 5 to 10% end up committing suicide. Now, the treatment part of schizophrenia. Antipsychotics are the drug of choice for all schizophrenia subtypes except catatonic or symptoms of connection. So, antipsychotics could be either first generation or typical, or the second generation or atypical. The first generation or typical are act by D2 antagonism. They treat the positive symptoms, but they have an increased extrapyramidal side effects but a lower metabolic side effects. Whereas the second generation or atypical antipsychotics act on the D2 and 5-HT2 receptors. They are dopaminergic and serotonergic antagonists. They act on both the positive as well as negative symptoms. However, positive symptoms are acted more by the second generation antipsychotics. There is a decrease in extrapyramidal symptoms but a higher metabolic side effects. Drugs are chosen by their side effects profile. How long does a patient have to continue antipsychotic medications in in schizophrenia? If the first episode if this is the first episode a patient has schizophrenia, he has to take the medications for at least 2 years. If the patient has 2 episodes of schizophrenia, he has to take a minimum for about 5 years. If a patient has more than 2 episodes, the duration of the treatment is indefinite. Now, the patients of schizophrenia, their insight about the disease is absent. So, they have a poor compliance. So, long acting injectables are preferred, or a depot antipsychotics once a month or 15 days IM is also beneficial. What is treatment resistant schizophrenia? The lack of responsiveness to two different antipsychotics given for adequate duration and in adequate dosages is called treatment resistant schizophrenia. The drug of choice for treatment resistant schizophrenia is clozapine, which is the first atypical antipsychotic. Clozapine has a maximum weight gain risk of side effect but a minimum extrapyramidal side effect. And it also has clozapine also has anti-suicide property. Now coming to the prognosis of schizophrenia. Schizophrenia prognosis is good when the onset is acute or abrupt, occurs at a later age, the patient is a female, and there are abundance of positive symptoms with less of negative symptoms. The category of catatonic and paranoid schizophrenia fall in the good prognosis category. There are positive affective symptoms, and family history of bipolar disorder is a positive or good prognosis for the patient of schizophrenia. The bad prognosis of are the onset is insidious. The patient does not know since when he has or had been behaving like this. There is an early age of onset, the patient is a male, and there is abundance of negative symptoms, that is, negative affective symptoms, and the patient has a family history of schizophrenia. The simple and epiphrenic or dissociative subtypes of schizophrenia have a bad Prognosis. Thank you for listening to this audio lesson on schizophrenia. If you found this audio lesson useful, please give a like, share with your friends, and subscribe for more medical audio lessons.